When I came to New Mexico about 12 years ago, I was impressed that every week a patient would get flown into University of New Mexico. They would come from all over the state. We would look at the films, look at the patient, and invariably discharge them the next morning because the films were misread or the patient simply didn't have anything that was close to what the emergency room doctor thought the problem was. And this really isn't a kind of care that is good care, and it's neither is it care we can afford anymore. It's wasteful care.
You know, people don't want to be flown to other places. They want to stay here. They want their local doctors and their local hospitals to take care of them. So, you know, when somebody comes in with a stroke or something neurological, we need to get a specialist involved in the case earlier rather than later, and so this provides the excellent avenue for that. Clot-busting drug that will dissolve potentially the clot in your brain and make.
So Access brings a neurologist or a neurosurgeon into your emergency room, the local community hospital, to help differentiate the kind of problems the patient has. Are they really emergent? Are they ones in neurology that need special medications? Or is it something that could be kept locally? What we've learned from Access, from putting neurologists and neurosurgeons in your emergency rooms locally, is that the vast majority of patients that used to be put in airplanes really don't need to take that trip. Now, the economic impact is enormous. It's enormous because you're avoiding airplane rides that cost $40,000 a ride. And we keep patients in their local communities, which allows the DRG the monies that are associated with an admission to stay in that local hospital.
Right now, when you send dollars out of state, what happens is that the neurologists, nurses, all that support structure to take care of the patient resides in Texas. When you're able to keep them in Roswell or Alamogordo or Raton, then you have that care being provided locally, so that you have that billing happening in the local communities, you have that nursing support happening in the local communities, you have the occupational therapy, the physical therapy, all happening local, so it builds that local infrastructure. So capacity builds upon capacity.
So the fact that we've got 24/7 access to neurologists and neurosurgeons that can stand essentially face to face with a patient is a fantastic thing. This is a perfect avenue to allow the specialists, subspecialists to go to these rural areas anywhere in the country, or anywhere in the world for that matter, and provide expert medical care. I mean, this is the cutting edge of what the future is going to hold in medicine. There's a shortage of doctors across the country. This is going to broaden the area that doctors provide service.
So if you can get care faster when it's needed, so that the messages always go to your local hospital, rather than bypass the local hospital to go to the urban hospital, to go to the city, because your concern is that your rural hospital doesn't have the capacity to take care of you. The message is get to your local hospital. The resources are available because the local hospital, that small hospital, is working with the University of New Mexico.